Good morning. Today I am giving presentation on pediatric assessments and pediatric disorders. Assessing a child is very different than assessing an adult, so we should to write down these 4 key points. Number 1, we always interact with the parents first and the child second. This helps to build trust with the child and family. And then the second, encourage the parents to be involved with the child. It's important nclex tip. For example, let the child sit on the parent's lap during the physical assessment. Next, communicate with age-appropriate simple language understood by both the parents as well as the child. Example, one tablet each time it's complicated or difficult to understand. So we can say that 3 times in a day or 3 times daily. It easy to understand. We always keep medical equipment out of sight. This will help to decrease unneeded stress and anxiety. Invasive procedures are always saved for last. For example, ear examinations as well as BP. Vitals. So has a general rule on the nclex. We always do the least invasive first, like absorbing respiratory rate without touching the child. Example, physical examination of a toddler, which appropriate action nurse take. So keep the all medical equipments out of the toddler's side until it's needed. Next example, while preparing a physical assessment on a 22-month-old child, the nurse should complete the following actions in which order. The firstly, nurse interact with the parents first. Then use a toy to play with the child. Then take the child's weight and height. And last step is obtain vital signs. So you can see we are building rapport first and slowly progressing into the most invasive procedures. Then coming on infants. Infants 0 to 12 months are called infants. For the growth, we look at height. Now the height should be at least 1 inches per month. They should have 50% increases at 12 months. For weight, it doubles at 6 months and triples at 12 months. For example, a newborn baby weight around 6 pounds. Well, then at 6 months, it should be doubled at 12 pounds. At 12 months, it's going to be 18 pounds. This statement clearly shows that some complications occur. This statement showing delaying in growth. So report HCP immediately. If any complication is occur, then report HCP or doctor immediately. Then coming on nutrition. Breast milk or formula milk is advised to newborns or infants. Never cow milk. So remember, no cow for infants. And solids should begin at 4 to 6 months when the infant can maintain and control of their head and neck. Important point, give only one new food per week. This to done identify any unknown allergies and to take it easy on the immature GI tract. Now assessment of head. So for the head, at the birth, the head circumference is slightly bigger than the chest circumference, but equal in the size around 12 to 18 months. Then newborn have two containers, that one posterior and that another one is anterior. And container should be flat, and these containers should never be bulbing at rest or circum. This is priority. If bulbing or circum is seen, that means immediately report to HCP. It's priority of action. If the container is bulbing at rest, it means meningitis or increased ICP. If the containers are circum, it means dehydration or fluid volume deficiency. We must report these to the HCP or doctor. For example, a 3-month-old child monitoring for signs of increased ICP and anterior container is soft and flat, which most appropriate actions do. So answer is document the finding, because increased ICP will usually see bulbing containers at rest, but in this case containers is soft and flat. Next, closure of containers. So first is anterior and second is posterior. Posterior closed by 2 months and anterior closes by 12 to 18 months. Now moving on respiratory. We see nasopharynx, accessory muscle juice, abdominal breathing, non-productive cough. These are the priority signs of respiratory distress. And for excessive crying is another biggest priority sign. Tropically new mothers will come seek help for an infant that cries all the time here, not knowing that's perfectly normal. For infants to crying around 1 to 3 hours in a day for various reasons is normal, like hunger, thirst, pain. So the priority nursing action on the basis of nclex. We always assess the infant pattern of frequency, time of crying. Assessment always comes first. And it's very important to know that a high-pitched cry means increased ICP or some type of brain damage. And this is why the most important to do assessment before interventions. So always remember, we do assessment before interventions on any client. Now coming on teeth. The first tooth topically erupts between 6 to 10 months and the lower sentence season is first, and the 6 to 8 teeth in the first year. Now signs of teething are basically tooth dropping through the gums. This can be very irritating to the infant. So we often see growling, journal irritability. So as an intervention, we always do teeth care with the wash cloths. Then coming on infant reflexes. Is number 1 the Brzezinski reflex that tropically shows up 0 to 12 months. It's where the toes fan out when soaking the sole or bottom of the foot. The rooting and sucking reflex seen around 0 to 4 months. Sucking motion occurs when stroking the side of the cheeks or mouth. Toning reflex seen around 0 to 4 months. In this reflex, when baby placed on the back, the head turns to one side and infant flexes the arm of the opposite side. And another reflex is Moro reflex, Palmer reflex, plantar reflex. Moro reflex seen in 0 to 4 months. In this, baby responds to a loud noise and sudden movement. Palmer reflex seen around 0 to 3 months. So infant will grab on to any object placed in their palm. like finger, toy, spoon, money, or extra. Planter reflects in around 0 to 8 months. Now moving on to GI assessment. During During the first week of life, it is very common for newborns babies to have some small amount of bloody mucus inside their stools and then a yellowish brown colored stool. So newborn mothers are very concerned for medical advice when they see bloody mucus. The blood is in a newborn diaper, so remember we always assess to continue monitor the color amount because assessment always come first. Then if it continues, then it means that something is very wrong, like gastritis, constipation, equally another GI disorders or problems. So immediately inform HCP. In the third day of life, yellowish brown color is okay. Now toddlers 1 to 3 years. Height should be around 3 inches per year, and for weight gain usually 4 to 6 pounds per year. 30 months child weight should be 4 times greater than birth weight, and we also see weight gain showing down during and after the toddler years. Now for the head circumference increases by 2.5 cm during the second year, but then shows by half until age 5. Chest circumference with abdominal circumference by age 2. Then coming on nutrition. The child should already be eating solid food, and we always limit milk, or basically 2 or 3 cups of milk per day. And for juice, that is limited to 4 to 6 ounces per day. In toddlers should be weaning off liquid nutrition and eating more and more solid foods. Now in terms of safety teaching, choking hazards is always the number one because airway is always number one on the nclex. So we always cut the food into bite-sized pieces. Sit the child up when eating and cut the food into bite-sized shapes, not around. And we always avoid round foods. Some big foods to avoid. That is popcorn, peanuts, grapes, carrots, and hot dogs and candy, hard candy. The airway of the child is small, about the size of drinking straw. Since young children love to eat, place everything inside their mouth. It's a risk of airway blockage. We always cover the electrical outlets. We always lower the water heater temperature below 120 Fahrenheit. Apply sunscreen SPF 15 or greater before going outside, and reapply it every 2 to 3 hours while on in sun. For drowning, we close bathroom doors. Never leave the child alone near a body of water. Often bath tubes, toilet, pools are the most common places where the drowning occur. Next is for crib safety. Always place on the infant on the back to prevent SIDS, never on stomach. Prone position means high risk for SID. SID means sudden infant death syndrome. Nothing raised should be inside the crib. So do not put the infant to bed with a bottle. This means high risk for dental caries or cavities. We remove kid musical moles at 4 to 5 months, since at this age the infant learns to stand up. Next is car seat. Car seat should be facing in the back seat at 45 degrees. Never place the car seat in front seat. Never place padding under behind an infant and child in a seat. This might be more comfortable for the child. And around 2 years old, a convertible car seat is provided and can be facing forward. Preschooler. Now coming on preschooler. Height increases 2 to 3 inches in per year, and weight 4 to 5 pounds per year. 4.5 to 6.5 pounds per year, and has a nutrition they require 50% less calories than adult, with 5 serving of fruits and veggies per day, protein, carbs and fats. Now for activity and sleep. 1 hour of physical activity is advised at least per day, and allow 12 hours of sleep each night. Preschoolers have magical thinking, often do not understand cause and effect. Remember, this age group never understand cause and effect. Ear assessment. When the child is growing up, then we pull the ear. When the child is growing up, then we pull the ear up, and less than 3 we pull less, basically down and back. Basically, growing up for pull it up and back, and less than 3 years down and back. Now for schooler age, 6 to 12 years. 6 to 12 years old, the growth is very similar to preschoolers, with a height of 2 inches per year and average yearly weight gain of 4.5 to 6.5 pounds. Now for activity and sleep. For sleep, they require around 9 hours of sleep per night. For safety, when riding a bicycle, they wear helmet and ride in a direction of traffic, and use a car seat until around 4 feet 9 inch tall, and never place in near pool alone. Big risk for drowning. More specifically, on physical examination, we always treat them like mini adults. Now coming on adolescence. For growth, boys stop growing between 18 to 20 years old. General puberty age for girls and boys, 10 years for girls and 12 years for boys. Activity encouraging meeting with friends and peers. This age group, 12 to 18 year old, needs socialization and peer support. Thanks.